Mick Mulvaney is the director of the Office of Management and Budget. Director Mulvaney, good morning. It's good to have you with us, sir.
Morning.
Good morning. Thanks very much for having me, guys.
Before we get too wonky and into the nitty-gritty of health policy, just a straightforward question. A lot of people are sitting there going, okay, what's the bottom line? How many fewer or more people will be covered under this new health care plan you've unveiled?
You know, we started to get that question a lot, and the real answer is compared to what?
Compared to right now.
Well, you can't even compare Obamacare to right now, because what everyone seems to want to ignore is the fact that Obamacare is an unmitigated disaster. I live in one of the states, for example, South Carolina, where we're down to just one provider under Obamacare. If that provider leaves, my entire state loses Obamacare coverage. Obamacare is in one of these, what everyone seems to want to call a death spiral. Democrats even admit that the program is not working. So I don't think it's fair to want to compare what we're proposing today to what Obamacare might have been. You have to compare it to what Obamacare is, and it's a failure. And by that comparison, this new program is going to be a tremendous success.
Fair enough. Let me play for you something the president himself said on 60 Minutes about whether people will be covered. Take a look.
Everybody's got to be covered. This is an un-Republican thing for me to say, because a lot of times they say, no, the lower 25%, they can't afford private. But
universal health care.
I am going to take care of everybody. I don't care if it costs me votes or not. Everybody's going to be taken care of much better than they're taken care of now.
The uninsured person is going to be taken care of.
They're going to be taken care of.
How?
I would make a deal with existing hospitals to take care of people. And you know what? This is probably...
Make a deal. Who pays for it?
The government's going to pay for it.
Director, can you say that this plan keeps that promise of the president to cover everybody, universal health care?
Sure. What people are getting here is access to coverage that they don't have now. Keep in mind, again, we're comparing it to Obamacare. What Obamacare did was make insurance affordable, but care impossible to actually afford. The deductibles were simply too high, so folks could say they have coverage, but they couldn't actually get the medical care they needed when they get sick. We solve that by giving everyone access to health care they can actually afford.
Can we just pause you right there? Because a lot of people have said that's Washington speak. Access to health care is not the same as health care. Are you saying definitively that what the president promised, universal health care, will be available to anybody under this new plan?
Under Obamacare, we forced people to have insurance. It's a real easy way to make sure everybody has insurance, right? When you put a mandate on it and they don't participate in the process, when you take government and put them between people and their care. The program that we've talked about today that the House rolled out last night is a program that puts people in charge of their own coverage, and they can go out and get that access through the safety nets and the other things that we are providing. So I do think it's a dramatic increase and an improvement over the Obamacare system.
Director Mulvaney, the Congressional Budget Office obviously has not yet had time to score this, to tell people how much it's going to cost. You are a fiscal conservative. Would you, as a member of Congress from South Carolina, cast a vote on something when you didn't even know what it cost?
Oh, no, we will know what it costs before they vote on it. And in fact, I don't think they can vote on it on the floor without the CBO number coming in. But I think everybody who's looked at it knows that this is going to save a dramatic amount of money. Once you repeal the mandate in Obamacare, you repeal the taxes in Obamacare, you repeal the penalties in Obamacare, and you get out of that government-centric system, the CBO score is going to be very positive and helpful long-term to the deficit.
Let me just ask you quickly before I let you go, Director Mulvaney. As you know, in the Senate, a razor-thin margin for Republicans, 52 to 48. There are already 4 Republican senators who've come out and said they could not vote for this because it freezes Medicaid expansion in a couple of years. What do you say to those 4 senators?
Take some time, look at the bill. The White House worked very closely on the bill. We support the bill. And one of the things we wanted to make sure of was the states that expanded Medicaid got treated fairly, and also the states that didn't expand Medicaid got treated fairly. So I recognize their objections, but I think we've dealt with it in the bill, and I encourage giving them the chance to take a look at that to decide for themselves.
White House Budget Director Mick Mulvaney, thanks for your time on a busy morning, sir. Thank you.
Thank you.
Thank you.
Hello, Today fans. Thanks for checking out our YouTube channel. Subscribe by clicking that button down there and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives.